My name's Marina McBee. I'm one of the providers here at Capillary Pediatrics, and I have the pleasure today of interviewing Dr. Fox, who's been with Capillary Pediatrics for 26 years. Today she's here to talk to us a little bit more about a specialty clinic that she'll be a part of. So tell us about the specialty clinic. What do you go to?
Thank you, Marina. We are starting a specialty clinic at our old Vienna site. The Vienna Pediatrics office of CAP has moved to a new site in Oakton, and we are now going to use this old Vienna site to do a clinic where we see kids with some problems that are usually referred to a specialist, or that we don't have enough time necessarily in our own offices to do thoroughly. The three in particular are going to be headache, constipation, and obesity. And we picked Vienna because it became available, but also because we think it's centrally located and easy access for all of our patients from Falls Church to Ashburn. And so we're getting that going in May of 2025, very soon.
Wow, so exciting. And what will your specialty component be? Tell us a little bit more about that.
I will be running the constipation clinic and dealing with helping children who have a long-term problem, not necessarily long-term, but issues with having bowel movements. And we have children from babies until teenagers who have this trouble. And frequently people refer themselves to a specialist, but they have a hard time getting in, or we are unable to manage it, and so we refer them. And usually it's really an issue that most of us, if we have the time in primary care, we can manage. And so the idea of this clinic is that we will have the time, we'll have longer appointments than your typical sick appointments at our doctor's offices. We will have room to have follow-ups appropriately, which are very important in managing constipation, and hopefully help these children become healthier with their GI system. Frequently this can present in many different ways, but a lot of times people don't realize they're constipated. They come in with belly pain, they come in with accidents with going to the bathroom with urine, they have trouble leaking into their underwear. There can be a lot of things that present that don't people clue in right away that they're constipated, and so it can be hard to treat. And then once you are treating it, it responds really well, but it takes time. And so hopefully this will be a way to do that where we have the right amount of time to do the proper treatment.
Sounds like there are a lot of benefits to your clinic.
There are a lot of benefits. I mean, not only the physical benefits of feeling better, but also there's a lot of emotional components to constipation. You know, kids can have a lot of low self-esteem. It can affect their abilities to participate in activities, and just makes them not feel very good. And so by making them feel physically good, we can hopefully get rid of some of the stigma of being the kid who maybe is having issues at school around this, and get them over that hump.
Sounds terrific, and I think it sounds like it will really serve our patients well. You mentioned a couple of ways that this clinic will be different from our typical care. I think earlier you mentioned something about specialty clinics or specialists.
Mm-hmm.
Is there a bridge or some sort of connection between the two and what you'll be doing?
Yes. So this is an idea that has come along as talking with some of the specialists at Children's National Medical Center downtown. I'm sure we're not the only ones in the country talking about it, but a way that primary care docs and specialists can work together to get these kids seen sooner than they're able to, like I said, at the specialist, and that we have the support of the specialist when we run into problems. And so while we have protocols, we've worked a lot on this and feel very confident. When there are issues that we get stuck or a little more complicated, we will have access and discussions with the specialists as we need to about those hiccups. You know, what would they do if they would see this? And then we can go back and work with our patients closely on that. So we will, you know, for the vast majority of these kids, we'll be perfectly fine taking care of them. But for those where we need a little extra help, we will have that inside scoop in time to talk to the specialist. And then ultimately, if we have kids who even then are having further problems, we can refer them to the specialist. And the idea is that being part of this program, you could get in sooner than otherwise on your own.
Wonderful. Well, this sounds terrific. And when I think about our patients and maybe some that are hearing this now that are feeling like this hits home, how does a family go about making an appointment with you?
You could do it several ways. You can call us and say, I would like my child to be seen at the specialty clinic for constipation, and we'll set up an appointment with you. You can, when you're seeing your doctor, if this issue comes up, they can refer you to this clinic, which really just entails you going to the front desk of your particular office and just saying, I need an appointment in the constipation clinic, and they will set something up that we have available for you and works in your schedule. Or you can go online to our website, and we have self-scheduling for this also, and you can do it all on your own from home.
Well, thank you, Dr. Fox. Thank you for your time and for setting up this service for our patients. We
Thank
appreciate
you,
it.
Marina. Thank you.